Our next speaker was scheduled to be Jeff Johnson, the president of the Washington State Labor Council. At the last minute, he had a conflicting meeting that he absolutely had to go to, and David McLanahan is going to read the remarks that Jeff Johnson intended to make.
The Washington State Labor Council's convention starts tomorrow in Wenatchee, and there was an emergency meeting for the Labor Council to plan it this afternoon, and Jeff lives in Olympia, so his wife prevailed on him to not do this round trip up here and get up very early tomorrow morning to go to Wenatchee. So I'm very honored to be asked by Jeff to read the remarks that he was going to give to you folks today. First, I should say Jeff is really a true leader for healthcare rights for everyone. He's a member of the Labor Committee for Single Payer, the Labor Campaign for Single Payer, which is a national organization with reach into unions across the country. He's also more or less the acting chair of Healthcare as a Human Rights Washington, which is a new alliance that maybe I'll describe for a couple minutes, which is a very important opportunity to realize creating a mass movement to demand a waiver in 2017 so we can move ahead with a innovative plan in our state. And we really think that the only innovative plan that will guarantee healthcare as a human rights is a state single payer plan, such as Vermont has and such as Healthcare for All Washington has championed for many, many years, the Washington Health Security Trust. So let me read Jeff's remarks. I want to thank PNHPWW for the opportunity to share a few thoughts about organizing for a universal single-payer healthcare system in Washington State based on human rights principles. My regrets for not being able to actually join you tonight. Since PNHP's last public meeting on May 4th, 2013, many things have happened. According to a Gallup poll, the percentage of uninsured has dropped by 4.6%. A recent Commonwealth survey showed that there are 9.5 million fewer uninsured. The same survey tells us that 73% of people who have recently bought health plans and 80% of those who have recently signed up for Medicaid are somewhat or very satisfied with their new health insurance. And a message to the Tea Party, 74% of the newly insured Republicans like their plans. And as a parent of 3 children between the ages of 22 and 26, continued coverage under my health plan is truly a blessing. But still, for all the leaps forward in health insurance that the ACA has brought about, we are a far cry from providing universal affordable health care to all on the basis that is their birthright, the fundamental human right, rather than some commodity that they should be able to purchase at a certain price. Fully implemented, the ACA will still leave tens of millions of individuals without health insurance and adequate health care. The cost of health insurance will remain unaffordable to many individuals and families. Dental and vision care will remain beyond the means of many. There remain no disincentives to corporations from either forcing high deductible and unaffordable plans on workers or simply dumping workers onto Medicaid or the exchanges, and with the Taft-Hartley plans not considered qualified health plans, many union health plans will not survive. Given the continued gridlock in Congress, the battleground and the organizing opportunity for real health care reform are the 50 states. While less than ideal and certainly not easy, states have an opportunity to seek waivers in the year 2017 from the federal government to set up universal single-payer systems in their states. The state of Vermont has passed such legislation with the passage of the Green Mountain Plan that will allow them to receive a waiver in 2017. Their legislation was rooted in human rights principles. But even for Vermont, the battle is not over. Vermont is now struggling with the very real question of how they will pay for the plan, and this will undoubtedly put strain on the human rights principles upon which the waiver legislation was based. So the other big thing that has happened since May 2013 public meeting of PNHPWW is that labor, PNHPWW, and other single-payer and community organizations have come together under the banner of healthcare as a human right. We spent, as you heard from Marty, we spent time early on honing a set of principles from which to operate. And there's a publication out front here from the Healthcare as a Human Right Washington Alliance that lists those principles. You can pick up a flyer. We have also made the decision to raise money to hire Washington Community Action Network to lead us in the community organizing efforts to win a federal waiver in 2017 or after. With Washington CAN's professional field and phone canvas around the state and experience in organizing around the ACA, we feel confident that the Healthcare for Human Rights campaign can mobilize a winning effort. But it will take an extraordinary effort. We will need 50 votes in the state House, 25 votes in the state Senate, and the governor to enable us the opportunity to even achieve a waiver. This is a daunting task that will pit people against the medical industry insurance complex. It will take significant funding and organizational commitment to make this happen, but the stakes could not be higher. Either health insurance remains a commodity beyond the reach of many, or health care becomes a human right that we all, regardless of legal status, are entitled to. The real issue is not what is affordable and what is not affordable, but whether we as a nation choose or choose not to recognize the fulfillment of our basic needs as human rights. The people in this room have made this choice through their past and present efforts in PNHPWW. Now we need to take those efforts to scale by supporting the Healthcare as a Human Rights Washington campaign and bringing people's voices to the center of the debate. Thank you. This is from Jeff Johnson. I think I'll take this opportunity to give you a very brief history of the Healthcare as a Human Rights Washington campaign. This was an idea that we at PNHPWW started with a couple years ago when board members went around to meet with other progressive organizations in the Western Washington area to talk about what we really need is a grassroots support for healthcare as a human right to get anything done in Washington State. And the idea of this grassroots campaign would be to achieve a waiver in 2017, which is the ACA allows to move forward with the innovative state plan, which, as I said, would be a single-payer plan in our state. So we met with 14 organizations. They all seemed to agree that this was a good idea and that a mass base was necessary to do anything given the power of the competition, the opposition. So the organization has slowly moved forward to meeting once a month, and hopefully there'll be a big future for this as the campaign rolls forward. So keep an eye out for Healthcare as a Human Rights Washington. You can help out by getting your picture for the photo campaign here, which we're going to use with in our campaign to get other people involved, and also let our legislators know that people in their districts are wanting this. Thank you.